Okay, so this is the discussion on sport biomechanics. So as I said, the sport activities that we look at in this talk are going to be the only ones that you're going to be responsible for from a testing perspective. Again, just some things to kind of point out. Again, make sure you're kind of understanding the movements that are happening with the phases and the muscle activity. So again, awareness of the anatomy is going to be important, but make sure you're kind of going beyond just kind of memorizing. So what I'm basically going to be doing is for these sport activities, I'm going to give you some like key points that I want you to be aware of. Okay. And those key points are going to be relevant based upon, some of the stresses and everything that are going to occur with these sport biomechanics. So we don't do the activities of daily living chapter because I think if you could analyze and know what goes on with these sport movements, that could kind of carry into other things that you do. So I certainly think there's carryover. For instance, if you could analyze a baseball pitch and understand the dynamics of the movement, understand the anatomy and how it's working, I think you could probably understand just even basic activities of daily living. So as we look at this picture, so again, I'm going to be discussing the phases, so you can kind of see this on here, and it's a pretty good picture. There's some slight shortcomings that I'll talk about that at least I see with the pictures in the description, but I don't think it's anything that's going to extremely negative, that's going to negatively impact how you're understanding this. So I'm going to go through the different phases, and at the end of all of this, so I'll always show some sort of like key point slide just as like a summary, but obviously I want you to kind of note these different points that I'm talking about. And again, certainly you can use your textbook reading to kind of accompany this. Again, as I said, don't worry about reading the other activities. I mean, unless of course if you have a genuine interest in it, that's fine, but I'm only going to talk about certain things, okay? So you see here with baseball, we have the windup, we have the cocking phase. I'm not going to talk about early versus late cocking. I'm just going to talk about the cocking phase as one particular phase, arm acceleration and follow through. So when we look at the windup, so the windup essentially begins the motion. We start to generate energy. It ends when the ball basically leaves the glove. Okay, so once the ball leaves the glove, the windup phase is over. Fingers are basically used to grasp the ball during this. And the idea is, from the standpoint of force production, the pitcher's trying to keep his fingers in contact with the ball as long as possible. And the reason for that is the longer he's able to maintain contact with the ball, the more force he could put behind it. So again, it's kind of that balance between force and speed, trying to be able to generate kind of enough force behind the pitch. This is what we call the quietest part of the pitch because of the fact there's like essentially the least amount of muscle activity possible. And one of the things that does occur is you get a transfer from the front to the back leg. So you can see here when when he's standing, that weight's been transferred to the back leg. The front hip and knee is going to be flexed to about 90 degrees, and there's trunk flexion. Now, it's a little hard to see with this picture. So really should only be about 90 degrees of hip flexion here. The picture kind of makes it look like there's extra hip flexion. There's going to be some trunk flexion that's taking place too. So the trunk and the thigh are going to approximate a bit. You're also going to be getting some upward scapular rotation because of the fact you're starting to bring the arms up closer to overhead. So that's what we look at with the windup. Now, as we move on to the cocking phase, now I'm going to kind of talk about the cocking phase as one area. I'm not going to separate it into early and late cocking. So you can kind of reference both pictures as we're kind of talking about this. So the cocking phase is when the body starts to move forward and the weight starts to move towards the front leg. So obviously this leg from the windup phase is now going to come down to the ground, and that's when you're getting into the cocking phase. The ball is also the farthest from the target. Again, the reason being is you want the ball farthest from the target. That's going to allow you to, in the case, particularly when you're trying to throw a fastball, allow you to generate more speed. So you're going to be in shoulder abduction, external rotation, and there's going to be some horizontal abduction as well. So you can see that pretty good in this picture here. You can see the shoulder abduction. It's also obviously horizontally abducted, and you're getting external rotation taking place as well. With the hip of the stance leg, so this is where, again, lower body strength is actually, people always think of arm strength, but your lower body has a pretty significant contribution to the baseball pitch. So at the hip of the stance leg, you have the hip extensors, the abductors, the knee flexors, and plantar flexors kind of working really hard. So if you think of like the glutes, the hamstrings, also the glute medius as well, the gastroc soleus, the hamstrings are all going to be working on that stance leg to kind of help generate and propel force going forward. The front leg is actually working eccentrically, and it's working eccentrically because it's trying to accept the individual's body weight, okay? And another thing to note, and you can see this in the early cocking phase, that the trunk is actually going to face the third baseline, okay? And it's going to be perpendicular to the target. That's going to put the arm in optimal position in order to generate force. It's also going to allow for maximum energy transfer from the hips, okay? So that is going to be a lot of your points. You're also going to have maximal wrist extension. So those are the important points regarding the cocking phase. And again, you might want to stop and kind of take a minute to make sure that you get all your notes together as you're kind of going through this. As we go into the acceleration, so acceleration is going to begin right after maximum lateral rotation. So once you get that maximum lateral rotation in the shoulder, then acceleration is going to begin. It's going to begin the forward movement. It's going to end once the ball's getting released. So actually what you're seeing here is actually kind of the end of the acceleration phase because the ball's out of the hand. This is the most explosive portion of the pitch. The elbow is going to move towards extension. You could kind of see that taking place here throughout these movements. So again, sometimes you have to look at the phase before and the phase after to kind of understand what's going on. So you see the elbow here in more closer to full extension. The wrist is going to go to neutral. The trunk is going to be facing the batter and is going to be flexed. The stride leg is going to take on the majority of the weight. So the leg that's kind of coming out is now taking on the majority of the weight. Kind of had to work eccentrically through the cocking phase, but now it's going to be accepting that weight. The position of the pivot leg, and you can see this is pictured pretty well here. You have the hip in extension, the knee in flexion, and the ankle in plantar flexion, and the picture does illustrate that very well. The muscle action during this phase is primarily concentric. And some of your muscles that you're really looking at becoming active here, you have the pec major, the subscapularis, the serratus anterior, the lat, the triceps, okay? So if you're looking at this motion, you can see what's really becoming active. The wrist flexors are also very active during this phase. So then we have the follow through. That's from the release through the end of the motion. So you can see in this phase, again, this is pictured pretty well. The shoulder moves into medial rotation and the arm gets adducted across the body. There's a lot of deceleration forces here. So eccentric activity is going to be the big kind of force here because of the fact the arm has to slow down. So again, just picture a fastball. I mean, even if you're not really into baseball, you obviously know to throw a fastball, you have your arm moving very fast. Well, during the follow-through phase, the arm has to eventually stop. So the follow-through phase kind of guides that deceleration process. And again, that's not only from the muscles in the shoulder joint, but also the shoulder girdle. Think about the serratus anterior, the rhomboids, and the traps. Also, because it's not just the humerus that has to slow down, but also the scapula has to slow as well. And you're also going to be getting eccentric action of the trunk extensors, okay, or the erector spinae, because as your body's coming forward, the trunk extensors or your paraspinals has to slow the trunk down. Otherwise, you would just kind of, his forward momentum keeps going. If those trunk extensors don't kick in, if his back muscles can't support him, he's just basically going to fall forward. So eccentrically, that they're going to have to work in order to keep the person as upright as possible. So again, key points. And again, this kind of summarizes everything. So what I would probably suggest in this particular talk, given the way this is getting discussed, and even when I would do this in person, I would suggest students kind of go back after listening to me talk about it and just double check to make sure they have everything. So again, think of ankle, knee, hip, trunk, shoulder girdle, elbow, wrist. So we mentioned something about all of those different joints. Note whether the muscles are contracting eccentrically, concentrically, isometrically, if there's any portions of co-contractions. And again, what's the purpose of each phase? So we mentioned kind of like a quality or purpose of each individual phase. Again, that would be something that would be important to note. And again, that kind of tells you, like, so for instance, in the follow-through phase, as one example, we mentioned how the purpose is to, again, eventually allow the arm to come to a stop. So in order for that to happen, you have to have eccentric muscle activity in order to decelerate the limb. So next, we're going to talk about the softball pitch. So the softball pitch has a very different dynamic to it than the baseball pitch. And you see that particularly when you talk about injuries. So just from a sports medicine perspective, you tend to see different injuries with athletes, with softball pitchers versus baseball pitchers. And that's because of what their arms actually have to do. Interestingly enough, softball pitchers, at least from my perspective, don't tend to have as many shoulder issues, primarily because the motion is a little bit more natural. It's basically like a circumduction motion. Now, elbow problems, I have seen, elbow problems kind of come up in softball pitchers, but even the elbow problems tend to be different in softball versus baseball pitchers. We actually talked a little bit about that in some of the strength and conditioning courses. So when we look at the softball pitch has a little bit of a different breakdown as far as the phases. It's named based off of the faces of a clock. So you still have a wind-up phase. You have the 6 o'clock, the 3 o'clock, the 12 o'clock, 9 o'clock, ball release, and follow through. Okay, so they're named a little bit different based upon the face of the clock. So, and again, it's the motion that occurs at the end of the phase that is really the most important. So again, that's something to keep in mind of. Again, sometimes the still pictures when you're trying to demonstrate this, I think they serve a good purpose, but you have to make sure you're using them right to make sure that you're really understanding the motion. So make sure you're doing that. So we look at the beginning of the pitch. This isn't really in here. At the beginning of the pitch, the shoulders basically flex until completely overhead. So that's not pictured in this. So basically, if we were showing that, you'd be seeing her arms basically both over her head. The wind-up phase ends once she reaches the 6 o'clock position. Now, this phase is going to vary a lot with each individual. They're going to be standing typically in a straddle stance with the pivot foot in the front. Okay. So the pivot foot's in the front. In baseball, the pivot foot is in the back. So that's kind of one different thing that you could kind of note. The weight begins on the back leg, and that kind of begins the arm motion as the pivot leg starts to push. The wrist is an extension, and the back leg is going to be using the hip and knee extensors and plantar flexors to move towards the ball. So that's going to be pushing the leg forward. So you can see in both instances, the hip extensors are working, but here actually now we're actually getting more knee extensor activity. So we're actually getting more activity of the quadriceps versus the hamstrings in the baseball pitcher. The pivot leg is going to then accept the weight via eccentric contraction of the hip and knee extensors. So when this foot comes down, so basically the person's going to come back, push forward, the pivot leg is going to accept via eccentric contraction of the hip and knee extensors. And really what you're going to be looking at muscle activity wise is for the shoulder flexors, particularly the pecs and the anterior delt, to move the arm to the 6 o'clock position. Okay, so obviously the shoulder flexors, the arm is going to be coming forward. They're going to be moving the arm into that 6 o'clock position. So now that we're at 6 o'clock, as you can see the arm in that position, okay, the body weight's going to be on the ipsilateral leg. Okay, which again, that's one of the biggest, I mean, in addition to the shoulder, the lower extremity is doing something much different than in the baseball pitch as well. So that's something important to note as you go along. So the body weight's going to be on the ipsilateral leg. The arm's going to be medially rotating, and the shoulder is going to be continuing to flex. Muscles with the greatest output is going to be your infraspinatus and supraspinatus. The anterior delt the pec major, the trap, and the serratus anterior are all going to be looking to start upward rotation of the scapula, because you can see 6 o'clock, the arm is going to be coming up. So that scapula is going to have to upwardly rotate as you come through. The triceps is going to hold the elbow in extension. The wrist is going to be in co-contraction, so being kind of held in a neutral position. The body weight is going to shift to the pivot leg. The hip and knee extensors are going to accept, much of what we discussed earlier as we were ending the wind-up phase. And with the back leg, the hip and the knee extensors are going to push the body weight forward. So you can kind of see that a little bit here with the back leg. So basically the hip extensors, the knee extensors are going to be pushing the body weight forward. So that's unlike the back leg in the baseball pitch, where the knee flexors are actually more active. And part of that is just because of the general motion that you have. The softball pitchers, when they pitch, they crouch a little bit more. So it's almost like a semi, it's not like a full squat, but it's like a semi-squat position. So that's where they get a little bit more activity of their knee extensors as they do that. As we move to the 3 o'clock position, so 3 o'clock goes from 3 o'clock to overhead, okay? You're going to start to gain acceleration here. You're going to end with the shoulder in lateral rotation, full abduction and flexion. So, I mean, this is basically the end position here, but that's where it's going to end up. So that's going to be the movement that's going to take place. The body weight's going to move forward, and it's going to rotate towards the pitching arm. The stride leg is going to continue to move forward, and it's going to advance towards the target. Your infraspinatus and teres minor are going to be working to do that lateral rotation. Now, in this, the bicep activity is going to start to increase. So the bicep activity is going to start to increase during this phase, and the triceps are going to continue to maintain extension. So you're going to start to get a little bit more co-contraction here of both the bicep and the tricep. So moving on to the 12 o'clock position. So again, this is the end. So this is what we were describing earlier. So the 12 o'clock is going to be moving from 12 to 9. So at the 12 o'clock, though, you're now going to have the weight transferred on back to the other foot. And you can see that in the picture. You're going to start to get medial rotation as the arm starts to accelerate. The stride leg is going to be far in front of the body. So you can see the stride leg being far out in front of the body. Your muscle activity here is going to be from the subscapularis and the pec major. The serratus anterior is going to be working very hard to stabilize the scapula. So remember, in addition to protracting the scapula, the serratus anterior also works to stabilize the scapula up against the rib cage, and that's going to be very important when you're looking at this. The trap is going to be contracting eccentrically to downwardly rotate the scapula, and you're going to be transitioning more from tricep activity to bicep activity. So the bicep is actually starting to take over a little bit more of the force development. The tricep is starting to kind of quiet down. At 9 o'clock, your shoulder is going to be in lateral rotation. The bicep is going to be most active during this phase. The trap and the serratus anterior are going to be contracting for controlling the scapula. The arm is actually going to be moving closer to the body in the frontal plane beginning at 9 o'clock. So you can't really see that here, but the arm is actually coming closer to the body in the frontal plane, and we'll talk about why that is in a bit. There's actually an important function for that. The subscapularis and the pec major are actually starting to contract eccentrically, and the wrist is going to snap into flexion as you're kind of coming through here. So then at ball release and follow through, so we'll kind of talk about this together. So 9 o'clock obviously transitions through ball release. With follow through, as the ball leaves the hand, we were talking about how in the frontal plane, the arm is actually moving closer in the frontal plane towards the body. The reason being is that the arm actually makes contact with the hip. So as the pitcher's coming through and they go to throw the ball, the arm's actually going to contact the hip. What that does is it actually helps in decelerating the arm. So in addition to the muscle activity, the arm also decelerates because of the arm kind of hitting the hip. Okay, so that's a technique thing that helps with the deceleration forces. You're going to have the elbow flexors working, the shoulder flexors and the adductors working. The stride leg is now primarily the weight-bearing leg with the knee and hip extensors and the hip, both abductors and adductors. And the hip flexors are going to be working on the pivot side. So that's the relevant muscular activity as we look at ball release through follow through. Okay, so just a key point wrap up here. So again, comparison of the windmill softball pitch to baseball. Again, the position is going to be based upon the arm at the end, and the muscles you have concentric, eccentric, and co-contraction occurring. So again, very similar to what we talked about with baseball. I made note of all the important muscle actions and everything that you need to be aware of as far as both the upper and the lower body. So now we're going to move on and look at the instep soccer kick. So, and again, one thing I want you to maybe even take away from a lot of this is, again, when we look at a soccer kick, we think of it being more of a lower body dominant activity, but there's upper body involvement. The opposite of that is the two we just looked at. When we look at the baseball and the softball pitch, we'd classically think of them as upper extremity dominant things, but there's obviously a major impact from the lower extremity. So I think that's another thing you can take away from this, looking at just the mechanics and how the upper extremity and lower extremity and how they impact each other with these different activities. So when we look at the soccer kick in general, one of the things we talk about that is getting kind of that optimal speed through what's called the tension arc that gets created. So with the combination of hip extension and abduction and trunk rotation to the opposite side, you kind of get this release of tension or this whipping effect that, again, kind of incorporates both, the upper body, the torso, and the lower extremity to get a good power behind the kick. So if you look at this kick as it's happening, so here you see that, hip extension, abduction, and the trunk rotates to the opposite side. So, this say in this is the right leg, the trunk kind of rotating to the left as you wind up, and then they kind of come together. So what happens basically is that left shoulder kind of approximates the right leg as they do that. And throughout this movement, the upper extremities add for balance and support. You notice that the shoulders are in abduction during this. And what that does is it just allows the body to support itself more. So as we kind of go into the different phases here, you have both the name of the phases along up here. We have actually some of the movement dynamics associated. So for the backswing, we also refer to that as toeing off. So what we start to see here is the shoulders start to go into abduction, okay? The contralateral goes into horizontal abduction. Now you can't see that, but again, here we're looking at the right leg, so that left arm starts to move also into horizontal abduction, because remember, the left shoulder is going to move further away from the right side as you're doing this. So obviously we have the glutes, the hamstrings, and then the tibialis anterior and the peroneus longus are also going to both, the tibialis anterior is going to dorsiflex and the peroneus longus is going to evert. You're also going to have the medial rotators starting to contract a little bit when we look at up at the hip. As we move over to the leg cocking phase, okay, the leg cocking phase begins when the knee moves into flexion to prep for acceleration. So you can see the knee starting to flex, the hips obviously extending, you can see that. The shoulders maintain at level, so they stay abducted. That opposite side, again, is kind of moving further away. And you start to get that torsion effect developed at the trunk. The upper body is going to rotate towards the non-kicking leg, because remember then that's going to come together as the kick occurs. The hip is going to be basically doing the same actions as with the backswing, except now the foot is going to move into a more plantar flexion, okay? And again, it's kind of hard. That aspect is a little hard to see, but it's starting in a little more dorsiflexion here. It's plantar flexing, okay? Then with acceleration, you're going to start to get forward foot motion. So the center of mass is going to be behind the support foot. So that's one thing you see. So if you see the center of mass would basically come down here. Here's your support foot. So it's a little bit behind there, and that's going to help with some of that acceleration motion. the trunk is also going to start to unwind. So when the trunk was kind of, the left side was sort of getting further away from the right side, now it's coming together. So basically the right shoulder and the torso is rotating towards that right side leg. With the arm motion, you're going to get some greater elevation and some more horizontal extension of that arm. The ipsilateral arm is going to stay kind of in straight extension. As far as the leg muscle activity in the stance leg, the glute medius is going to have to work really hard on that stance leg to maintain balance. If you think about it, in the stance leg, even we talk about walking, we talk about the activity of the glute medius. That glute medius is going to have to work really hard to maintain your balance. And the quad is going to keep, in the stance leg, is going to keep the knee in slight flexion. Okay. Then obviously you have ball impact, and then we're going to talk about follow through. So again, follow through, again, the idea here is to reduce the risk of injury. The contralateral shoulder and the kick hip move towards each other. So you kind of see, you get this approximation of the left shoulder and the right hip. The trunk is going to flex forward. But again, that forward flexion, remember, think about how that's occurring. That flexion is going to be through eccentric activity of the erector spinae, because again, you're trying to slow down and decelerate trunk flexion. Same thing on the kicking leg. The hamstrings are going to be contracting eccentrically in order to kind of slow the leg down. Okay, so very, very important to look at that. Even coming back to this, so think about, another thing to think about as the leg's going through, think about what the pelvis is doing as you're doing this. So obviously as you're extending here, if we go back to this and talking about the pelvis, okay, as the hip goes into extension, the pelvis has to tilt anteriorly. It's going to be tilting anteriorly. Now as it accelerates, then you're going to be getting a posterior tilt of the pelvis kind of as you go through the kick. So that was kind of a little backup there about the pelvis, but again, it's the same concept as what we look at anytime you get interaction between the hip and the pelvis. So again, just key points. Again, upper limb and torso contributions. Okay, again, think about that. And again, you might want to just take a pause and go back and just sort of review a little bit some of the muscular actions, again, keeping in mind any concentric, eccentric, and co-contraction points.